Yeah, my name is Ken Dempsey. I'm an RN and a Master's in Education, and at the VA, I'm a Mental Health Outreach Coordinator and now a doctoral candidate, retired Lieutenant Colonel, U.S. Air Force. But I am here today to interview Mr. Shore, Mr. Peter Shore, CEO and founder of Retreat Behavioral Health, to build and strengthen a collaborative partnership that we have to facilitate drug and alcohol treatment, rehabilitation, and lifelong sobriety and purpose. Our goal and our hope is to replace substance dependency with a passion and commitment to individual interests and growth accordingly. Mr. Shore, I thank you for inviting me here today or accepting the request, and look forward to a community collaborative effort and a collective meaningful impact upon the community and upon our veterans. So I'd like to start by saying that our organization has need of short, middle, and long-term residential treatment for alcohol and drug use disorders with mental health components in the Palm Beach County area. These treatment terms would be defined as anywhere from 30 to 90 days normally. Residential, and we're looking for a robust, effective, affordable residential treatment facility which will benefit our veteran population, maximizing recovery potential and minimizing the chances of recidivism. So we all know, or most of us do know, that the recidivism rate in alcohol and drug use is extremely high. We know too that South Florida is one of the meccas for drug use and alcohol use, but also it's becoming more and more one of the centers for treatment and recovery as well. So many programs have sprung up. Our program, your program has been examined and inspected by our team. So the team is myself and Ms. Hay, and our findings have been very positive. In addition, the patients we have sent have had positive experiences and outcomes in general, and I thank you for that. I have a few questions, only 25 or 30, maybe. No, just a couple. 8 questions. Some of them are pretty similar to each other here. So I would ask, how will Retreat Behavioral Health assess and monitor those individuals who appear to need continued close monitoring after discharge from the formal program in order to be successful in the long term?
Peer support is very important. Aftercare is very important. We take that very serious, and our patient care coordinators who do all the aftercare planning really monitor that and make sure that when someone leaves our facility, they have a proper plan in place. Even patients coming from the VA, usually going back to the VA, but there's a lot more involved in that. There's housing involved in that. There's a lot of different things. And we have a very active alumni association that a lot of the vets are part of.
This is something we look forward to.
Yeah, so a lot of the vets are part of that. We have vets that have gone through here a couple of years ago that have come back to work here. That are doing fantastic, and they're great for the peer support too. They keep people in the loop. They let us know what's going on out there with their fellow comrades and things like that.
Well, that kind of continuity and follow-up is just what we're looking for. So, what steps do you have in place to foster real recovery, knowing that 30 to 90 days is just kind of a beginning, and supportive, cohesive settings are needed for several years, and you've already addressed that.
Yeah,
so,
like I said before, 30 even 90 days is very, very limited on what people need treatment, because a lot of the people who are coming in, the substance use disorder is secondary to the mental health disorder.
Yeah.
And if we don't treat the mental health disorder, nothing changes in the substance use. So, we made a conscious decision to really look at the mental health disorder, especially over the substance use disorder, because a lot of times they do go hand in hand, but the reason they're using and abusing is because of the mental health disorder and the pain they're feeling to numb themselves and things like that. Especially with vets and combat vets, especially who have PTSD goes, it's a vicious cycle. So we try to peel that onion away and find out what's making that patient sick.
So I see that as the second tier, because the first is like addressing a problem that you see, but you're going to the underlying problem, and that's a good thing. You mentioned PTSD, which is something that's big with our veteran population. Not all of them have it, but there's depression, there's all these comorbidities, and we really have to think about which came first. And again, the substance use, the alcohol did not occur in a 30 to 90 day period. It's been going on for probably years, sometimes from childhood. There's all sorts of things that have to be addressed, and so it's long term is something that we really look for. So as we form a collaborative partnership, what do you see as the elements needed to address the needs of our clients in order to best serve their recovery goals? It's really a part of question 1 and 2, but
Again, having a relationship for a couple of years and treating vets is, it's that continuity of care. I don't want people to think that they come in, they've done, 30, 69 days, and that's it. They don't have, I'm good. And you hear that all the time, not just with vets, but everybody. They've gone for treatment and they think that's it. And we talk about recidivism, but, statistics show that someone who goes to a 30-day treatment program does nothing after that. Only about 7% of the people stay clean. So terrible.
So,
terrible.
these statistics
But,
are bad.
But if you, have an aftercare plan in place, you follow through with that, you get connected to a fellowship like A or NA or whatever works for you.
NA or AA or
whatever works. But, you find that you have to find that what fits you. It could be a religious program.
Sure.
It's something that you could be connected to. But, the statistics go up to like 45, 50% people stay clean and sober that do that. People ask me all the time, what are the percentage of people that stay clean and sober that go through your facility? I said 100% of the ones that listen. It's the ones that try to chart their own course.
Right.
It's difficult. It's a difficult thing you're dealing with. You're dealing with a disease.
Right.
People understand, it's not, you can't will away a disease. You need to learn some skills and learn some tools that you can do.
And there is where you address the mental health issues underlying, because I don't know if I've ever seen alcohol abuse or substance abuse disorder without some mental health.
I'd say that today, 70 to 75% of the people that come into treatment have some underlying mental health disorder that's been untreated forever.
And unrecognized, So what barriers do you see in going forward with the continuum of care? And it's so important in our population, in the veteran population, but in the overall community as well.
Barriers, there's no barriers except for the ones that people put up themselves. There's help there. You gotta want it. You gotta do it. You can't. Like I said before, you can't just will it away. So the barriers are the barriers that people put up themselves. We form a good relationship. We form relationships with hospitals, and again, when people come in for treatment, we want them to follow what's laid out for them, not to try to chart your own way, because that's been a disaster for all along.
So you're leading horses to water and coaxing them to drink the water, but you can't force them. And I understand that, speaking of horses, there's an equine aspect to your treatment, which is nice because general population, but the veteran population respond well to horses.
Horses
are
are
wonderful.
Equine therapy has been really, really productive for us, especially with people who have had trauma in their lives and people who have trust issues.
Absolutely.
Because you're picking up a 1,200-pound horse's hoof and it doesn't kick you. You develop some trust. If it kicks you, then we have a problem. We haven't had that yet.
But you learn.
But you learn. But then you learn to duck. But it's really good. It opens them up. The thing, people come closed. They're holding back resentment from whatever their lot in life is. They have to blame someone. So they're closed. But you got to find something to open them up with, whatever it is. If you can use equine therapy to them lower their guard and they start talking about what's going on, you get a home run.
Well, coming in this morning, I talked to a gentleman who's out there. He's not one of our clients, but he had good things to say, and he said, we keep busy with a lot of the programs here. We have one-on-one, we have group, there's a pool here. He mentioned the horses, the sports. I've seen your gym. They have a state-of-the-art gym. I would like to get membership.
It's important to move. We do have, we want people to stay busy here. you know,
Yeah.
off time is their biggest enemy sometimes because they start getting in their own heads. And, you know, after a while, it gets a little better as it progresses and they go on. But you want to, you know, even 90 days, not a long time.
No,
We've got a lot of work
I
to
know.
do.
I know.
We have a lot of work to do. We're 7 days a week, 24 hours a day. You know, we have nurses here 24 hours
Yeah.
a day. We have therapists here 24 hours a day. We have clinical aides here 24 hours a day. There's someone here to talk to.
And we took a careful look. In fact, we've been here twice and did a top to bottom assessment. And we found some really very, very good things. And we looked at the licensure, and we looked at the robustness of the program. We looked at the campus, and we're very happy. So we need to move forward with, we've been doing this in an unofficial sense in that we have not had a formal contract. And so wearing my other hat, we'll work on formal contract, but for here now, we're just glad to see the success. How long have you been open here? Is it 3 or 4 years?
It's about 3.5 years ago.
3.5 years.
And we just celebrated our 8th year in Lancaster, which we treat a lot of vets in Lancaster,
Yeah.
all over the country.
Yeah, close access to the Washington.
We have New York, we have even Syracuse.
No,
Sends all our vets, especially for mental. There's a mental health license there too, except for so a lot of the 90-day programs come from Syracuse, Pittsburgh, Altoona, but you know all over there.
Yeah, I got a buddy in Altoona. Sure, and I know people in New York. It was my old stomping grounds. To ask you this, how would you handle a situation when a patient becomes suicidal or threatening to others?
Well, threatening to others is something we take very seriously. I mean, if people are suicidal and they want to hurt themselves is serious enough, but if you want to start hurting other people, we have to take that serious. And you know, we can't keep them on campus if we can't control it. But we have, again, like I said, we have, you know, again, people suffering from depression, they have suicidal ideations, and we talk through it. We have one-on-ones. We keep people with people who have suicidal ideations. They stay with them 24 hours a day. Again, we're 24/7. Medical's here, so we do that. But if it's something that it's not controllable on this kind, you know, we'll send them to a high level.
Okay. I like the fact I'm from this area for a lot of years, and so there's a hospital nearby that can handle Baker Act, that can handle
less than 2 miles
suicidal
away.
ideation, and a real and it's not, it's blocks from here. It's not far.
Suicidal ideation is different than plan,
Sure.
obviously. So, you know, suicidal ideation, a lot of people say they've had suicidal thoughts and things like that. And you know, our medical director is a psychiatrist, so, you know, we feel pretty secure in the knowledge that he feels, you know, that's not something that's imminent and that's something that we can handle. You know, we that's what we're here for. You know, sending him somewhere else, what is that going to do? That's not going to do any difference, unless it's, you know, severe. You know, we're here for that. That's what we, you know, I always tell people, you know, in Pennsylvania, we have a mental health day, so we need to send them a higher level of care. I go, we are the higher level of care. We don't need to send anywhere. This is why we have such a professional staff and full-time psychiatrists on board.
Very good. Awesome. Another question is, how would you handle clients who may have shortfalls in ability to pay for their treatment? It happens as people, maybe the young people.
It happened a lot for
any
us,
age.
but you know what it is? Especially when people come in who need detox.
Yeah.
You know, they don't have insurance, they can't pay for it. You know, it's life or death situation. Sure. We're not turning them away. You know, that's not something we do. I mean, and you know, we've always had, since I started in Pennsylvania over 8 years ago, we've done detox for one of the local VAs, all the detox. And they come to detox and then they have to go to residential and go back to the VA. And sometimes they would say, you know, we don't have a bed available. We'll have one in a few days or a week. Send them to a homeless shelter.
Oh boy.
And I don't do that.
Could be a recipe for failure.
But I don't do that. I would never do that. I would keep the person there as long as until they have. You know, again, when we talked about continuity of care, it's going from handoff to each place, so you know that it's safe.
One handoff.
Yeah, and we're pretty adamant about that.
And I know that you have steps in place for disaster threats. Hurricane This is a big thing here. I've seen your generators. I think you have two gigantic.
We have
generators.
3 generators. We have
Three.
2 in the
All right.
other building and 1 in this one. And, you know, a couple of years, 2 years ago, I think it was it Wilma? Was it Wilma 2 years ago?
Yeah, that was a biggie.
We were out of power for 5 days. You would never know. Not one
Well,
thing goes out here when the power's out.
And you can remain in place, and it's looks
Our
like it's solidly built. So.
staff comes here when there's a hurricane. We have
there's a
89
families.
people sleep here.
Okay.
This whole building becomes a dormitory because they feel safe.
Well, awesome. So I want to say we appreciate your participation also in the mental health summit that the VA actually sponsors now. We've been doing it for 6 or 7 years. I've been an active part in putting that on and a speaker, and we appreciate your input
Right.
in the mental health summit.
We appreciate that you do things like that. You know, it's
and-
not the same old conferences that we go to all the time. It's something that really
It's substantial.
educational and substantial. It makes sense.
I've seen the emails from you advertising events that you sponsor or you participate in or you put on, so which is a good thing. You mentioned the PTSD and you know I'm into the education piece.
We just did a big panel discussion. We had over 500 people show up. We talked about mental health in our youth. We had one of the panelists was from the school in Parkland, it was Shaw.
Oh boy.
We had the head of 211, the suicide prevention hotline.
Yeah.
We had a professor from NYU. We had one of our community reps who's a therapist who was one of the first responders at Parkland, and myself. And the questions that young people asked were mind-boggling. You wouldn't think that they would have this. Like, you know, the main thing is, what do I do? Where do I go? And education's so important. I mean, education, not just for children, for parents too, because they don't know. And you know, most of the kids said, look, when I tell my parents, they say, just buckle up, you'll be fine. You know, that's not the right answer. And the schools that, you know, Florida, we're lucky. Florida just passed that law where every kid in 6th grade has to have mental health education, which is great. I mean, that's something
Would be a good way of
that's the start.
identifying and screening as well as passing information.
It gives them education. Education is important. So these events that we have, we want them to be educational. We want to participate in things that are educational because it's important getting that out there. People don't, the layman doesn't understand, forget about substance use disorder, they don't understand mental health. You know, and they all think that mental health
is still there, unfortunately.
The stigma is, you know, everyone needs to be in a straitjacket.
Yeah,
You know, when I first got my mental health license in Pennsylvania, my staff questioned, you know, are people going to be in straight? I said, it's not a lockdown facility. It's not a psychiatric hospital. We deal with mental health. You've been dealing with it since we've been here. Nothing's changed.
I think that the media over the years, better recently, but portrayed mental health in a very negative. We think of Bedlam and some of the other places.
One flew over the cuckoo's nest.
And we think of all of these horrible. That's not the norm anymore.
No, that's
so wonderful. So follow up. We love the whole idea of follow up, and I know that what other outreaches do you have? We've seen several informative articles. Other community activities that you're involved in. We mentioned some of them, and I received the emails. And I wanted to say, too, that for my doctoral program, it's focusing on trauma and youth, and I have in mind Parkland, the elementary school right here,
So a lot of
Marjorie Douglas, Stone Douglas, and a child with obvious mental health issues that kills a bunch of people. Who would think? Where did this come from? And too many people politicize it, whether it's right or left, and when it's really a mental health issue, is it not?
Totally.
So,
mental health. Which
what other
wasn't unheard of. People knew that,
yeah.
but they didn't do anything about it because they didn't know what to do. Again, education, talking about it. If you're a high school and you understand what mental health is, and you see something out of the norm with one of your peers or something like that, you're going to say something. He's just acting. What do they say? We don't like to use the words crazy. We don't like to use the words insane. We want to get away from those words because that stigmatizes mental health. So we try to enforce that and say, you know, don't call someone crazy. crazy. Don't say they're insane. Again, we want to get away from the stigma of everything that has to do with mental health.
And with the modern convenience that we have, I put away the cell phone actually, but you can text and children, anyone can spontaneously put out a comment there, however harmful that can be to another person. It can have an effect on somebody who's wrestling with some mental health issues, and we have I won't mention the social media in particular, but there's all sorts of pitfalls out there, and a lot of our young people are subjected to a lot of absolute bullying and the craziness, whether it's far left, far right, all of the craziness out there. And the young mind just can't quite assimilate.
And, they need time, and your brain doesn't really officially become something who's total clarity until you're about 25, they say.
I'm still working on it myself. So.
Me too.
Well, is there anything else you wanted to put out there? I just thank you for.
I appreciate that you coming and asking these questions, because these questions are important. These questions that, you and I are sitting here talking about, we need to get this out there to the public. We need to be advocates for people who suffer from mental illness, who suffer from substance use disorder. We need to be their advocates, because, again, you still have that stigma. You became an addict or an alcoholic. It's your own fault. It's your own doing.
There's still people who believe that a weakness.
Most people.
I participate in the suicide prevention. We had a march, a walk last Saturday, a couple of days ago. We do that every year for my own personal reasons, and my wife and I do that. But education is so important to get out there. People would say, "Why are you celebrating suicide?" We're not celebrating it. We are acknowledging that this thing exists and making people aware of signs and symptoms and what could happen. We don't want people to do it. We obviously don't encourage, but let's get educated about it.
Are you aware of 211? 211?
Yes.
So, I mean, they're not all therapists when you call, but people understand you need to have referral places to go. What do I do? Who do I call? People don't know. And that's what's great about 211. You can call at any time, and they will, they may not have the answer, but they'll refer you to a place that'll give you the answer.
And then there's a direct crisis line. It's 1-800-273-TALK, T-A-L-K. It's 1-800-273-TALK. It's in Canandaigua, New York, in the freezing cold country, but it's also, there are centers around here, and it's for the general public and also for veterans, but it's also a great crisis line. It used to be called Suicide Prevention Line, it's crisis line.
Correct.
But so we see Retreat Behavioral Health as being a very robust, good program, and hope to continue and build more collaboration.
We're growing, and we grow with what's going on in not just the industry, but in society. We want to better ourselves, because if we better ourselves, we better the treatment that we give to the people who come. So we take it very serious who comes through those gates. We want to make sure they get what they need.
Well, thank you, Mr. Shore.
Thank you.
Thank you very much. I appreciate that. And thank you.